This is the average fit group, and this is the most fit group. And in black we have girls, and open ones we have boys. So from 1998 to 2003, 2004, fatness is going up in the lowest fitness group. It's fairly flat, but going up slightly in the middle fit group, but it's even going up in the fitness group. So fatness is not just an issue for the obese, it's an issue across the whole population. The whole population seems to be shifting up in overweight. So we need population-level programs, not just programs which focus on obesity. And one of the problems we have in the UK, in a sense, you get funding for programs if you focus on obesity and overweight. Whereas essentially, it's not just, even these fittest lot seem to be gaining in body weight. Really important message from that paper. That's 16,000 children in Liverpool, a fairly robust piece of evidence. What's encouraging at the moment, though, we've now extended this to 2008. So we were dropping in fitness, but now we seem to be plateauing. It's bottoming out for both boys and girls. So we're getting a bit of a bottoming out effect, not getting any less fit. And fitness is really an interesting concept as well, because are people getting less fit? Well, not if you measure grip strength. Have you ever done grip strength? Grip dynamometer, squeeze it. Grip strength is actually going up. So we can't say the population getting less fit, they're getting less aerobically fit. And we've used this information to design programs for overweight and obese, because overweight and obese people are very good at strength-related activities, but they don't have to move their body weight. Very positive for their self-esteem. And then skin folds. This is we take skin fold measures as well in this study. And what's really encouraging, different to any other part of that we know of the UK, we're actually seeing a flattening off in overweight or in fatness. So something again, you know, we've got this increase in activity in the adult population. We've actually got this slight trend, flattening trend for over fatness, and we haven't seen that in the States. Obesity keeps going up. You know, there's been no ceiling. In Liverpool, we seem to be slowing down a bit, and that's not just on 1 year's data. That's 3 years' data, more or less. There's been a slight upward trend in the boys over the last year, but not a lot. So maybe some of the fact that the investment into programs in Liverpool are having some kind of a slowing down effect on the rate of increase in overweight.
What happened in 2004, 2005? It seems to be
yeah. It's not the program.
Yeah, exactly. There's a little bit of a blip there. I think what may have happened here in terms of statistically, I think we had I'll tell you what happened here. We had a problem here in sampling this point here. Have any of you heard of sudden death syndrome? Sudden death syndrome, some children. Well, we had to change our ethics procedure. We were stopped from testing. We stopped from testing, and we had to make sure that any testing site, we had an automated defibrillator on site to restart something, because the incidence of sudden death ranges between 1 in 500 and 1 in 5,000. So I think we slowed down. So this may be a slight blip because of that change in numbers. But they are difficult to explain sometimes. Okay, there's another project in Liverpool. Does anybody know what the recommended amount of activity is for children per day? Anybody know the recommended amount of activity for children per day?
1 hour? 2 hours.
1 hour. Well, 1 hour in the UK, 1 hour in the States. 2 in Finland, perfect.
1 in Australia.
1 in Australia, yeah, 1 in Australia. So it's 1 hour. So in another study in Liverpool, where we actually use a very detailed body scan, we actually split the groups into the kids who were active for more than 90 minutes, 60 to 90 minutes, and less than 60 minutes. And there's a real benefit for being more active, of course. You're less fat, the more active you are. But these children who were active for more than 90 minutes, these are 9 to 10-year-olds again, were still about 26% body fat, which is horrendous. 26% body fat, these lot, and they're active for more than 90 minutes. So the activity recommendation of 1 hour is just not enough. So in Finland, 2 hours is got to be good, really. And Australia, I guess, would be the same. It's just not enough. I would guess.
Yeah,
no, I would guess it's just not enough. So there's some interesting data coming out of Liverpool that we've been doing at university in some detail that may also have influenced national thinking about. Elite sport, this is my favourite game. These two guys are playing the same game. He's 2 metres, he's 1 metre 49. Interesting from a maturation perspective. I'm more interested in the body fat though. Does elite sport have any impact? So these are sort of measures we take in the labs where I work. It's the body scan through a DEXA, fitness measures, which are really detailed particular studies. And these are just trajectories of body fat. These are 14 to 15-year-old players. Body fat's going down in the fattest players and going down slightly in the slightly leaner players. But between 2006 and 2008, in this particular group, instead of body fat going up, these guys are playing elite sport. These are my sons, by the way, these two guys, so I always get them in my presentation somewhere. These body fat's actually going down. So there's a particular group of youngsters who engage in this elite level of sport who don't seem to need to have some investment that we give them. So it's just a nature or nurture issue. You know? For some of these players, they're actually quite fat. This is actually dropping. There's been a really large increase in lean body mass. So for some sport, it's really good for body fat. And particularly for these elite players, they don't get any fatter. Okay, so that was the issue around body fat. I'm going to pass over to Massimo now to talk a little bit about the work we've been doing with racial minorities in Liverpool. Oh, yeah, we control the maturation.
Good afternoon, everyone. This is a great honor for me to be able to present in this conference, and it's my first time in this part of the world, in Finland. Before I start talking about this community project that we did in Liverpool, I would like to share some personal experience that I have gained since I've been living in Liverpool. One is that I am now able to speak English and to speak Scouse, which is the language which is spoken in Liverpool. Scouse. It's just they have such a strong accent. So when I first arrived in Liverpool, they were speaking to me, and I'm like, I have learned English in my country, and I just don't understand what these people say. And then I found out that they speak with that really, really strong accent, which is called Scouse. For example, they always say "he," and I thought that's German, but it's English. And the other experience, which is related to my work, is that I started working in this place called Dingle Community Learning Program as my first experience of working in the UK. And from then, I have gained the true sense of community, what community means. There are lots and lots of communities in the UK. I think just the whole UK is full of communities. People come to UK from different backgrounds, different nationalities, from all over the world. And then they just gather together and they form these communities. And what they do, they actually link with the government through the communities. They may not speak the language. They may not know about the British lifestyle or British system, but they get their message across, and that's because they work through the communities. And this is what I have learned in Liverpool, which is a really valuable experience for me.
Excuse me, you are saying that it is part of the British policy to encourage and facilitate people to meet in communities,
yes,
as a clear concept, a format.
Yeah. Which was really, really interesting, because this doesn't happen in my country. I'm not sure about Finland, but I have learned about this in the UK. You have people from Africa, from Asia, from Eastern European countries, from Middle East, and they all have their own specific small or large communities, and they just They just communicate with everyone through those communities, which is, I think, great. Now, the project that I was involved with was to do with women from black and racial minorities in most deprived areas in Liverpool. What we tried to do was to identify the barriers which stop these women from getting involved in physical activity. So we tried to get a measure of the current engagement of any physical activity, to explore the determinants of physical activity, and to try to understand their views and attitudes about physical activity, to identify whether they know about the facilities which are available in their area for them, and also to explore the perceptions of factors that might be encouraging or discouraging for physical activity behavior, and also to develop ideas to promote physical activity among black and racial minorities. I give you an example about when you say views and attitudes. Where I come from, when you talk about sport, physical activity, there is not a clear definition of physical activity and sport. When you want people to become physically active, all they think of is just sport, structured sport like football, like volleyball, like basketball. Maybe they don't consider walking or cycling or any other activity as a part of physical activity. So we were trying to find out if these women who come from different backgrounds have the same views. Methodology was an opportunistic sampling strategy. We approached 225 women, out of which 213 agreed to participate in our study, and they aged between 18 to 60 years old. They were from different nationalities: Africans, Arab, British Arabs, Pakistanis, Indian, Bangladeshis, Chinese, British Chinese, Afro-Caribbean, Irish, mixed backgrounds, Eastern Europeans. And we found these women in social events and in venues which we thought they might be there, such as churches, mosques, community centers, workplaces, offices, and also in their homes. What's interesting about this community project is the way the methodology was developed. Two groups were formed. One was called PAG, Partners Advisory Group, and the other one was called CRAG, Community Researchers Advisory Group. Partners Advisory Group included representatives from Liverpool City Council, Primary Care Trust, Liverpool John Moores University, Women Health Information Support Center, and I always forget that one.